Early on, Dr. Roger Wynn, who we referred to as the father of the guidelines program, had the idea that process maps would be a good way for people, for busy clinicians, to use information about what is the standard of care in the large cancer centers. The evolution from diagnosis through palliation actually reflected the way that a clinician would think about managing cancer.
I've been a member of the NCCN and the guideline panel since those early days. And I've had the opportunity to see the evolution of the guideline process and the guideline development over all those years, as well as the growth of the organization as a whole. I can reflect upon the fact that we had just a couple of pages that were all that were to the NCCN guidelines for breast cancer at the time. Over the course of all those years, we've seen the evolution of the guidelines, which is really a reflection of the advances we've made in the treatment of patients with breast cancer.
The NCCN is a very collaborative alliance whereby representatives from each of the institutions that are members of NCCN are represented on the panel. And that means we get representation from multiple different specialties. For example, on the breast cancer screening and diagnosis guideline, we not only have radiologists and breast surgeons, we also have primary care physicians and patient advocates.
When we think about cancer care is really a holistic concept. It's not just the diagnosis and the treatment, but it's really the diagnosis and the treatment in the context of the whole person. And that's why it's important that the NCCN guidelines not just include the cancer diagnosis guidelines, but also include guidelines around supportive care, guidelines around prevention and screening, as well as guidelines around survivorship and end-of-life care, and that these guidelines are all intertwined and interconnected. Supportive care is really necessary for good cancer care. It's not just about how to treat someone's cancer, it's how to treat the whole person. And that's why the Library of Guidelines span from screening and prevention or risk reduction all the way through to survivorship and end-of-life care, because it really is that spectrum of the whole person. And I think both the expertise of our members and the fact that everyone comes together with an equal voice around the table is really something special that doesn't necessarily happen in other areas of medicine.
But I would say specifically the NCCN has led in sort of bringing experts together who are leading clinically and leading within the research space and leading in sort of in the supportive space to come together and create guidelines that are thoughtful, not just about treatment regimens, but specifically about patients' experience.
There are now 88 guidelines, and they cover an increasing spectrum of not just adult tumors, but supportive care guidelines and pediatric cancers.
Every study that I'm aware of looking at cancer clinical practice guidelines demonstrates that the NCCN guidelines are the most widely utilized guidelines in the US and outside the US. All of this serves to increase the quality of cancer care wherever the guidelines are used.
The other thing that was innovative about them is that while most guidelines required very strong evidence to include recommendations, the NCCN guidelines recognized the fact that there were patients whose situations were not covered by the highest level evidence. And the thought was that the experience of subspecialist clinicians treating those patients would be informative to people who had less experience. So we included both high-level evidence and sometimes even just the clinical experience of the expert clinicians in the guidelines. And we were able to differentiate them using our categories of evidence and consensus.
There are many situations in medicine where we don't have the level of evidence we would like to have. However, these are real medical situations. You have to make a decision. You have to plan a treatment program. And I think the guidelines help with that also.
cancer care has become more and more subspecialized and more complex. In my opinion, the guidelines have become even more critical to the care of every kind of cancer patient. And it's this ongoing renewal of these guidelines that is so critical for us to provide quality care for patients.